Now this, a small tuberculosis outbreak is being reported at migrant shelters in Chicago. Dr. Marty Makary joins me now. Obvious question, with all these people packed in pretty close in these shelters, how contagious is TB?
Well, TB is highly contagious. It's a respiratory virus, and it does spread in crowded conditions. The reports of the crowding right now in shelters is that it's the worst it's ever been in U.S. history. Children there, worse than it's ever been in U.S. history. But cameras are generally not allowed. The press is not allowed in there, so we don't have the vivid images that people may have seen in the past. That's new. That's a change.
But we've got a measles outbreak as well in these shelters. Is there a serious risk of, I don't quite know how to put it, but an enormous outbreak of contagious disease that cannot be contained, that brings these shelters down and out? I mean, is that possible?
For children within the shelters, measles is a significant risk. Now, the mortality rate is still low for measles, but anyone who's not immunized is going to be exposed. Those immunized, though, are protected. So American kids who receive their immunization have a greater than 95% protection level against it. And remember, very few are fatal cases.
But what are we going to do with people with tuberculosis and measles? What do we do? I guess we have to treat them, obviously, but it's going to be a vast cost, isn't it?
So over 500 kids have been immunized in the custody of Human Services. So there is an attempt to give children immunizations they've not otherwise received. Tuberculosis is often treatable, but not the multi-drug resistant form, which is a small percentage of the cases.
Okay, I'll change the subject for a second. We've got a new study, and it claims that working an irregular schedule as a young adult may harm your health later in life. This is about people who may change their shift, for example. Does that really affect you later in life?
I think so. This was an interesting study out of NYU. It shows that rotating the shifts that you work is associated with less sleep in general. In other words, the quality of the sleep goes down. And there's something there to the circadian rhythms. In my own field of medicine, we see it among the specialists that do a lot of rotating shifts. OB doctors, emergency medicine doctors, it affects mood and energy levels. And this study is suggesting that's a broader phenomena.
It seems, though, Doctor, like we're urging people not to try hard. Don't compete. Don't try to move up the food chain by changing your shift or working extra hours. It seems like we're being told not to try hard, that we shouldn't even start doing it. What do you say?
Look, some people find a very good rhythm with working late night shifts or overnight shifts. And I think the general suggestion from this study and other sleep experts is that those shifts should not rotate frequently. If somebody's in a groove where they like working evenings or like working overnights, it's good to keep some regularity to those shifts.
Okay, Doctor. You're determined to be a diplomat, I can see. Get off my lawn. Thanks very much, Dr. Makary. Always a pleasure. Come and see us again real soon, please.
Thanks, Stu.